The efforts between some world powers to secure coronavirus vaccine deals with pharmaceutical companies may be undermining the World Health Organization's plans to buy in bulk and distribute the vaccines more equally. It's being called vaccine nationalism by Doctors Without Borders. A slew of deals is underway by the United States, Britain and the European Union with companies like Pfizer, BioNTech and Moderna. But the United Nations believes the WHO plan is a fairer, cheaper and more effective way of curbing the pandemic. The concern is that the vaccine supply and allocation in this pandemic will echo that of the H1N1 flu virus in 2009 and 10, when rich nations bought up the available supply of vaccines, leaving poor countries with none. Back then, H1N1 turned out to be a milder disease and the pandemic ultimately petered out, so the impact on infections and deaths from vaccine imbalances was limited. But this time, experts say COVID-19 is a far greater threat, and leaving swathes of the world vulnerable will only extend the pandemic and the damage it can cause. For example, the Council on Foreign Relations, a Washington think tank, told Reuters, quote, "The handful of nations that are locking up the supply of vaccine competes with the multilateral supply deals. And at the end of the day, vaccine manufacturing is a finite resource. You can expand it, but only so much." One global scheme called COVAX is designed to secure rapid and equitable global access to vaccines. More than 75 wealthier countries, including Britain, have expressed interest in the COVAX financing project, along with 90 poorer ones who would be supported through donations. But there are growing signs that rich nations would rather go it alone. The United States, China and Russia are not among countries expressing interest. COVAX's aim is to distribute doses for at least 20% of countries' populations.